Hello, I'm Dr. Murray. We're going to show you a brief clip on how simple it is to place a dental implant following a traumatic accident. We are going to briefly demonstrate the ease with which an implant can be done, one that is done well. This version is designed to show the simplicity and to remove the fear that one might have. Our patient is Ryan, and just before the Christmas holidays, he was doing his best Shaun White impersonation in Mammoth, and I believe it was a snowboard that hit his front tooth. The tooth was fractured below the gum line, and the nerve was actually bulging out. This happened Friday, and Ryan continued to snowboard the rest of the weekend. At the time, we just temporized the tooth to get him through the holidays. This is all done under local anesthetic, which is the same as if we were doing a simple filling. Ryan is an actual patient and not a paid actor. We will be removing the remaining root and immediately placing an implant and a temporary crown. He will have the temporary crown for approximately 3 to 4 months, during which time the bone will integrate or grow around the implant. At that time, we will take an impression for the final crown. At this point, this is if you are interested in a more detailed version of this procedure. After placing topical anesthetic and anesthetizing the patient, I begin by slowly luxating the tooth from the mesial and distal side. This is the temporary tooth that we put on just before the holidays. Probably the most difficult part of this entire procedure is getting the tooth out without taking any additional soft tissue or bone with it. This bone here on the facial side is what I have to save. I take extreme care not to disturb the facial bone, as that is what will give us a superior result versus just an average result. You can see the tooth starting to wiggle a little bit here. I'm using a flapless technique, and I'm trying to preserve as much soft tissue and bone as possible. So here's the tooth here, and there is no bone attached to the tooth at all, which is good. Once the tooth is out, I measure it with a perio probe to approximately determine the length of the socket and to feel the perimeter of the bone. That's about 12 millimeters or so. And then the width is 9, of which I will need 2 millimeters of leftover bone on the sides of the implant. So I would take a 4.3 millimeter diameter and just kind of place it in there. You can see there would be a lot of play. The angle should be such that the facial of the implant is equal to the facial of the bone. If you are using a drill extension or a long shank driver, an excellent gauge is to have the shank line up with the incisal edge of the adjacent tooth. This will allow us to have an emergence profile that will best mimic the natural dentition. We've got a lot of play on a 4.3, so I will bump it up to a 5.0. Don't close, we're going to take an x-ray of that. You can use a stent or even a CT scan to determine the amount, quality, and quantity of bone, but on a young, healthy patient like Ryan, it would be a bit of overkill. I have not created a purchase point. I have just placed it into the extraction socket. Looks okay. I will measure the length of the root from where the crest of the bone was, and I'm about 11.71, so almost 12 millimeters. The implant, they come in sizes of 8, 10, 13, and 16. In this case, we will do a 13. If I measure the width of this tooth, it's about 5.75. So I'm going to use a little bit less than 5.75. I'm going to use a 5 millimeter diameter. I'm trying to measure from here to here. The width here I had at 5.75. So I need 2 millimeters of bone on each side here, so I'm not going to increase the width. 5.0 implant is very wide for a lateral incisor, so I'm going to keep it at that and not increase. But the implant itself will be longer than the apex of this. Now, about 3/4 of the way down the socket, or 2 millimeters from the apex, I will place a purchase point in the bone on the straight lingual so that I can begin my osteotomy. When I placed my initial pilot hole, I can see that I'm going to run into his adjacent teeth. So I'm going to use the drill extension. I run it very, very slow so that I don't necrotize the bone. So this is a drill bit, 10 millimeter length, and I'm running it with irrigation, both internal and external irrigation. Now I will step my drill sizes up in succession, hoping to place a 5.0 millimeter Noble BioCare tapered implant into the site. So this is 13 millimeters. The previous was run at 800 RPM. I'm gonna now go to 40. I'm not going to use water, and that is gonna carve threads into the side of the bone. I'm gonna do it probably until it torques out. You can see that there's bone that comes with this. You can remove that and place that around the implant after you place that. After completing my osteotomy, I will place the implant with the appropriate implant diameter. In this case, a 5.0 by 13 millimeter implant, which is a little bit longer and larger than I would normally do for a lateral incisor. So I just go directly to the site. I find my initial purchase point. I'm still trying to maintain the incisal edge, and then I'm going to just torque it in. I would like the implant to torque to 45 Newton centimeters with the head of the fixture equal to or slightly below the level of the crest. You would think that the tighter the better, but that is definitely not the case. We use a torque wrench just as though you were working on your car, and I want it to go in a little bit further, so I'm torquing it. It's better to under-torque than over-torque. If you over-torque, you put too much pressure on the bone, and it will necrose or die. And if the bone dies, then the implant eventually will get rejected. I will stop and take an X-ray to verify my depth and inclination. It is a 5.0 diameter implant with a 13 millimeter length. We have 2 millimeters of bone on each side, which is good, and we're stopped right at the level of the crest of the bone. I'm going to use a plastic temporary abutment because it's easier to block the color. If you use the metal ones, sometimes the grayness of the metal shows through on the temporary and it doesn't look as good. I prefer to do this out of the mouth. You can do it in the mouth, but sometimes the dust of the plastic gets in and can sometimes affect the integration of the implant itself. Now I'm taking that and I'm going back to the mouth and I'm putting it into the implant. Bite down, please. And I check for clearance, and I do have enough clearance. I will hand torque this, but if you use the machine to do it, you should not go over 30 Newton centimeters because you don't want to exceed what you place the implant in. I will put a little bit of cotton into the access hole so that the temporary material does not flow in, because if it does, then we won't be able to unscrew our screw. I am making the temporary. This is an impression that was taken before we started, and I'm placing it over the temporary abutment that we have on there. It will take approximately a minute and 20 seconds if you want to take it off. It came off, so that's good. I prefer it that way. That goes into the oven. Because this temporary is going to have to last 3 or 4 months, and typically temporaries only have to last a couple of weeks if it's for a crown or something like that. So we want this one to be a little nicer, a little harder, a little stronger. So now I'm removing the temporary from the mold, and I have to just trim that extra flash and make the tooth look real. And try it in and out of the mouth. By placing a temporary abutment onto the newly placed implant, I will develop the soft tissue profile, and I will make sure that there is no occlusal or lateral contact or forces placed on the temporary. I'm going to add a little bit to this corner because I don't like the way that looks. Dentistry is both an art and a science. And right now I am custom staining this temporary. I'm actually using a blue color for the incisal edge because it gives it some translucency, makes the tooth look more real. I'm dipping it into the glaze. That'll give us a nice smooth finish. And that will go back into the oven. I am placing a light cured temporary cement and very little because I don't like excess cement to get underneath the gum. This clear one is very hard to see. I don't want any touch.
I don't feel any.
And bite down and grind around side to side and open. There are no sutures involved, and I will place the patient on antibiotics for 3 days following the procedure. Looks okay. I typically don't prescribe pain meds as there probably won't be any, and I will recommend Tylenol or Advil over the counter, or sometimes even a combination of the two. We will then wait 3 to 4 months prior to placing our final restoration.
At the end of the procedure, there was really no pain throughout it, and the tooth looks very natural.
I hope you found this information helpful. Thank you for your interest.